Welcome to the 2021 Virtual JA Conference. We are so happy you have joined us today. Welcome back to those of you who participated in our networking or family fun night events, and a special welcome to those who are joining us for the first time today. Shane and I are glad you are here, and we welcome you to the JA family. The Arthritis Foundation and the JA Conference means so much to our family. This year marks our 12th conference. It was 10 years ago that we attended our very first conference in Washington, D.C. We were 1 year into our family's JA journey when we attended our first conference. Still trying to wrap our heads around everything, we were not quite sure what to expect at conference. From the moment we checked in at registration, I got this sense that we would be learning a lot that weekend. Little did I know just how much we would learn and what we would gain from this event. Shane and Luke met and made friends that met with many other JA kiddos and siblings. I was overwhelmed with tons of helpful information and resources. And most importantly, I found my tribe. We left our first conference feeling welcomed, loved, and having been accepted into the JA family. It's not something any of us would be willing to be part of, but we are so thankful and grateful for our JA family.
Our conference theme is Amplify, the JA movement. Our goal for this weekend is to connect with you and inspire you and get together as a JA community, amplify our voices to show we are strong together. If you haven't already, take time to visit the conference app and get connected to the Arthritis Foundation resources and to other attendees by participating in sessions. Today's fun theme is Amplify Your Favorite Decade. And we encourage you to post pictures of your family. Be sure to use the hashtag #StrongerThanJA. We have 40 states represented, as well as families outside of the US from Canada and the United Kingdom. Welcome to all of our JA family from across the globe. To our international friends, we hope to see you online as well. We have over 820 registrants for this year's virtual conference. Whether you are new or returning, we welcome you.
We have a special message to our first-time families. Welcome to a powerful community of JA warriors, the Arthritis Foundation's JA family. This is the 37th JA conference. While we are disappointed we are not able to meet in person, we are so glad you are with us, and we hope you find the connections and inspiration this weekend that the conference is known for. We would like to thank our generous JA conference sponsors who make this event possible. Presenting sponsor AbbVie, supporting sponsor Alpha Omicron Pi Fraternity and Foundation, and our additional supporter Genentech.
It's been such an honor to co-chair this event with my mom, and we are both inspired by all of the stories we've heard this week.
Each of us has our own story to tell about the challenges of living with juvenile arthritis, and we hope you'll continue to share yours. Together, we are excited to amplify the JA movement. Now I'd like to introduce the chair of the Arthritis Foundation Board of Directors, Frank Longobardi.
Thank you so much, Jen and Shane. And really, we so appreciate the fantastic leadership that you've provided to this year's conference. And, to think there's 820 people, hopefully on our call today, our 37th conference, just goes to show that, every year we get better. Every year we're building new resources and new ways to service our constituents who have arthritis. I want to echo the appreciation of this year's conference sponsors, whose generous contributions help make our JA tools and resources of this conference possible. So thank you so much, and we do appreciate it. I also want to thank our volunteers and staff. I mean, it's, I think back to March of 2020 and where we were as an organization and what was happening in our world. And to think of where we are today, we've done so many great things of making the Arthritis Foundation a volunteer-led organization, and you guys have done just an incredible job helping us through these times, and we really, really appreciate it. I also want to thank our JA warriors and their families for your participation. This is a great opportunity for all the new families to utilize the resources of the foundation, get to know people like other families that are impacted by juvenile arthritis. And you guys inspire me. I mean, you really do. You inspire me every day when I think about the courage that you all have in fighting this terrible disease. So our thoughts and prayers are always with you. I got involved with the Arthritis Foundation literally over 25 years ago, so it's been a long time. And I went from chapter to regional and been on the national board now for probably 7 or 8 years, and just took over last November as the chair of the board. And I'm looking forward to 2022 when we can hopefully get to see each other in person and spend time together, and hopefully that'll happen over the coming year. So what I'd like to do is also, I also just want to make one other point. I want to thank the rheumatologists and the parents who are on our board, the parents of juvenile arthritis children, and I'm really proud. I learn a lot from them when we have our board meetings, and they give so much to our organization. So now I'd like to introduce our faithful and committed leader who has made it a priority to ensure this conference took place this year, and it was important that we had this conference. So I want to thank Ann for all that she's done, and let's give her a warm welcome to our president and CEO, Ann Palmer.
Well, hi, Frank. Thank you. And welcome everyone to the kickoff of our conference. It's hard to believe that we're doing this another year virtually. I just don't know what to say about that. I know that each of us would really rather be together in person, and so that we could greet each other and hug and cry and laugh and toast each other. But I'm delighted that we're together virtually, that we're together here. And it gives me, it heartens me to think that we've had nearly 1,000 people who are going to be with us in spirit and on this with us today and over the weekend. I too want to give a special thank you to our new families. Hello to our JA warriors, moms, dads, siblings, grandparents. Welcome to the Arthritis Foundation. And I hope that you will feel that you have found your home with us. And we're lucky as a community to have so many subject matter experts, rheumatologists, nutritionists, others, but we're also blessed by having wonderful veteran families like the Cox family, who are here to greet you and to embrace you and to support you. And we again hope that you really find this conference, even though it's virtual, to be a game changer for you. When I talk about it being a game changer, how about Natalie Decker last night? She was amazing. And this is part of what we want conference to be, is the opportunity for families, for our JA warriors, to meet others like themselves and to really see that they're not alone, that there are others like them that they can connect with and feel comfortable. So many of us realize that our disease is invisible, and conference should be a place where you feel welcome and you realize that there are professional athletes like Natalie and others who have this disease and should bring us a real sense of hope and optimism about being able to lift up and raise our voice. Again, we don't have the chance to be together in person, and we're going through some challenging times. But it is our hope that you'll still be able to greet folks, to connect with old friends, to make with new friends, to talk with professionals in the field and learn new things. But ultimately, we hope that this is an experience where you can recharge, where you can have hope. You can leave here with hope about the future. I'm impressed with the unwavering commitments of our moms and dads who give back every year. People who give because they were helped by this community. This makes us a powerful community. People who come to get help, but who stay to help others. I'm sure many of you know, I've shared with you that I'm a mom of 2 daughters with a chronic disease. Heather, who has Crohn's disease and psoriatic arthritis, and Cece, who has Crohn's disease. And so I live many of the challenges that you do each day, challenges of insurance, the challenges of being misunderstood, the challenges of, every time a child calls, do you wonder if they're in pain? But I've also benefited from this community. I've felt as a mom, the warm support of other moms, and I hope that you all will be able to have this same experience of support from the community. The heart and the power of this community touches me. Stories of so many families are in my heart every day. They motivate me, they fuel me. They give me a sense of urgency about the work we do. And on this slide, you'll see a picture of a picture that hangs in my office and reminds me every day of an early advocacy conference that I attended. And our kids were in a separate room doing a branding exercise and talking about what they wanted most. And they presented this to me. And what they told me was that they loved their doctors and they wanted more of them, that they wanted less pain, and they wanted a cure. And this drives me every day. And I'm proud to say that in our work now, we are funding and creating new fellowships every year, that we're fighting for and thinking about quality of life and pain, and both mentally and physically. And in our work with CARRA, we're funding research, we're building a registry, we're looking at treatment plans. In short, we're fighting for that cure that we all want. Working together as a community also allows us to be very powerful in the advocacy arena. If we join hands, we can be powerful on the Hill and in state houses across the country. Many of you are Platinum Ambassadors, and I thank you for that. I want to share with you a recent victory. Many of you know that we've gone up on the Hill for years and asked for funding of the pediatric subspecialty loan repayment program. Doing this would make it easier for people to go into the field of pediatric rheumatology. Well, just last week, as a result of our hard work, your hard work, of you telling your stories on the Hill, the House Appropriations Subcommittee has approved $25 million to fund this program. Now, we haven't got it all the way through, but we will. And again, this is a great example of how working together as a community, holding hands, we can amplify our voice and make good things happen. I want to encourage each of you to get involved locally. Let's not make conference the only time that you're involved with us. We have many resources that we'd like to share with you. We have a local JA chair in your community who's eager to connect with you. If we go to the next, great, go to the next slide, great. We have JA days, we run camps. We have a local connect group where people can continue to meet face-to-face. We fund scholarships. This year, we funded a number of scholarships, more than any other year, to allow people incentive to get additional education. And we certainly want to embrace our new families with our JA Power Pack. All of this to say, please, please have a wonderful time at conference. Enjoy yourself, lean in, stay engaged with us. I hope you found your home with us at the Arthritis Foundation. And as I turn it back to Shane and Jen, I want to say, Shane, I'm very proud of you and how you've grown up, and I miss our face-to-face annual visits. Thank you.
Thank you, Ann. I miss it too. And thank you to Frank. Next, we're going to go to hear about the Arthritis Foundation's steadfast commitment to JA research. Our speakers today are Steve Taylor and Dr. Stacy Ardoin. First, I'd like to introduce Steve Taylor. Steve is the Executive Vice President for the Arthritis Foundation. Welcome, Steve.
Thank you so much, Jen and Shane, and thanks to the entire Cox family, including your dad, for all the steadfast commitment to juvenile arthritis and, of course, the JA conference. For those that don't know me, as Shane just said, I'm Steve Taylor, and I'm the Executive Vice President of Mission and Strategic Initiatives at the Arthritis Foundation. And I'm honored to be at my first JA conference, as just having joined back in February, and so honored to be here amongst some of the most inspiring arthritis warriors we have, are JA families and those kids that have arthritis. As a dad of 3 sons, one born with spina bifida, I know all too well how we all want our kids to have the best chance at life, the best chance to follow their dreams, and all live the life that they want to live. And that's why the Arthritis Foundation is so committed to JA research. I'm proud to join with all of you as we work together towards this weekend's theme, which is amplifying the juvenile arthritis movement. I'll share a little bit more about that as we move on. But on the next slide, I want to share with you one of my favorite quotes from a famous researcher and scientist, Marie Curie, who used to say, "I'm among those who think that science has great beauty." And the reason that research has such great beauty is because it gives us answers. It unlocks the mystery of diseases, and it saves lives. And that's why the Arthritis Foundation is so committed to JA research. Over the past 6 years, the Arthritis Foundation has committed nearly $30 million to JA research. So today, Dr. Ardoin and I will give you an update on JA research and show how your help is making a difference long-term for those kids with arthritis. On the next slide, and before we go into research, I just wanted to add to Ann's comments about the Arthritis Foundation's diverse strategies to supporting our JA families. And Ann did such a great job talking about our JA Days and JA Connect groups, ways to get involved locally. I just wanted to hit a few comments on our research initiatives, where we're working on strengthening our workforce in pediatric rheumatology, where we help to place pediatric rheumatology fellows in your communities. We also support research grants through CARRA, which you'll hear about, and of course our college scholarship program. But also, I'll later talk a little bit about our JA Insights program that is so important to our work in research, because we can learn so much about the input from the families when they take our JA Insights program that will help advance our work in the research field, but also on the programmatic side as well. I'm excited last night to have been joined by Natalie Decker, and Ann mentioned Natalie. For those that aren't familiar with Natalie's a 23-year-old NASCAR race car driver who was diagnosed with JA at 2 years old. She's a professional athlete that races alongside some of the famous race car drivers that you might know, despite having JA, having health challenges and setbacks. And her story reminds us that anything's possible, that your kids and those kids that are with us today, you can follow your dreams, and that the Arthritis Foundation is here to support them in your effort. And that's why research is so important, helping us to learn more, discover new treatments, and ultimately discovering that cure. On the next slide, you'll see CARRA and Arthritis Foundation and how we're working together. We're working on learning how to transition our knowledge that we learn from all of you through our patient engagement strategies, and how we can discover ultimately that cure for the various forms of arthritis. On the next slide, you're going to see the critical pathways of our work in the research pipeline, which is so important to be involved in early basic science to learn what's causing these diseases. So then we can take that knowledge, as we are doing, and translating it to patients, to the bedside, and to the practice. So that we're not just waiting to learn everything about the disease, but we're moving forward to get more treatments on the market, as well as ultimately that cure that I talked about. And as the slide says, together, CARRA and the Arthritis Foundation are improving lives through the power of research, but also I want to add through the power of your voice, as Ann said. So important in so much we do that your voice is heard and we listen, but you get involved and add your voice to our fight as well. So I'm so honored to be joined by a pediatric rheumatologist, Dr. Stacy Ardoin, today. For those that don't know Dr. Ardoin, she is an adult and pediatric rheumatologist at Nationwide Children's Hospital and the Ohio State University, both in Columbus, Ohio. She's also division chief of rheumatology at Nationwide. She's a researcher, a clinician, mom of twins, and fully committed to JA families, as you'll hear throughout her presentation and some of the stories that she shares. And she also serves on CARRA's board of directors as their treasurer. So we're honored to have such a leader in the pediatric rheumatology space join us today to give us an overview of research with CARRA and how we're doing in our partnership. And I'll be up later with some closing thoughts. So I'll turn it over to Dr. Ardoin.
Thank you so much, Steve. I'm truly honored to be here at this terrific conference to represent CARRA. And on behalf of CARRA, I want to express our tremendous gratitude to the Arthritis Foundation for its incredibly generous support for children and families suffering with rheumatic diseases through their commitment to education, advocacy, and their very generous support of research, including through CARRA. Next slide. I'd like to start by telling you a story, and I'll tell you about Antoinette. So I met Antoinette when she was 3 years old, and she came to see me in clinic because she was having terrible back pain. And throughout our discoveries, we found out that she had inflammation in the lower back and what we call the sacroiliac joints, which means she has a condition called spondyloarthropathy. And this is a type of JA. And this presentation, the spondyloarthropathy in a 3-year-old, is pretty unusual. So we were concerned and connected her with Bob Colbert, who you see on the next slide, in the upper right-hand corner. And Dr. Colbert is a very well-respected researcher who's expert in the area of spondyloarthropathy. He's at the National Institute of Health, and he's also an investigator in the CARRA network, and he is truly a leader in pediatric rheumatology. So Antoinette and her family traveled to Bethesda to meet Dr. Colbert and his team, and their family has participated in a long-term study of spondyloarthropathy with research projects ranging from the basic science that Steve mentioned all the way to improving treatments in the clinic. And one of the things that's been very interesting in our journey is the idea of personalized medicine. So unfortunately, Antoinette's arthritis has been really challenging to control. She's tried many different treatments without the kind of success we like her to see. And through our partnership with Dr. Colbert's laboratory, based on findings that he saw in the microscope in Antoinette's cells, we've been able to trial some medications which we would typically not think of as therapies for spondyloarthropathy to treat her. And this is the kind of approach to personalized medicine treatment and focusing on the cure of the individual patient that we hope to become the future of pediatric rheumatology. Next slide. Now, despite the challenges of having to live with ongoing arthritis symptoms, Antoinette's family has prioritized partnering with the Arthritis Foundation and CARRA to further JIA research in many different ways. So the picture you see here shows Antoinette and me as co-honorees at the Jingle Bell Run in Columbus, Ohio. We had a great time participating in the run and joining together for fundraising opportunities. In addition, Antoinette's family has been incredibly active in other fundraising efforts for the Arthritis Foundation, have been engaged with our local AF chapter, and have participated in several local and national JA events. On top of that, Antoinette herself has participated in the CARRA registry, sharing the details of her journey with arthritis with researchers to help us better understand JA. And Antoinette's mom, next slide, Emily, who you see here having fun on the lake with Antoinette, now participates in JIA research teams to help us develop research programs and activities. So very wonderful example of patients getting engaged in research. So I think that this is a very powerful story, which illustrates, one, the power of the parent and patient family engagement, advocacy, and research, and two, how the generous support of the Arthritis Foundation has helped CARRA thrive and promote research that will ultimately help find better treatments for all children with JIA. Next slide. So I'll tell you a little bit more about CARRA. So first of all, for those of you who don't know, CARRA stands for the Childhood Arthritis and Rheumatology Research Alliance, and that's a mouthful, so you can understand why we see CARRA. And our guiding principles are to have in research and with our engagement with patients and families, inclusiveness, trust, impact, and innovation. Our mission is to conduct collaborative research to prevent, treat, and cure, ultimately, pediatric rheumatic diseases like JA. And our vision is a world free of the limitations from pediatric rheumatic diseases. Next slide. So JA research is an exciting story. Since the turn of this century, we have seen an absolute explosion of new arthritis treatments, and as a consequence, improved outcomes for adults and children with arthritis. So I'm going to date myself, but when I started my fellowship in 2001, it was not uncommon for me to see children coming to their clinic appointments in a wheelchair. Now, fast forward to 2021, that is an absolute rarity. Patients are doing so much better that it's very rare for us to see needs for wheelchairs and other adaptive equipment. Now, while we've made great strides, we have so much more to do. Next slide. And we're doing this through the AF and CARRA Partnership and research. So one of the exciting programs that the Arthritis Foundation has sponsored is the CARRA Registry. This is a registry involving patients and families all across North America and actually now in Israel and Italy. Over 95% of pediatric rheumatologists participate in this, and there are 76 sites now participating. At these different sites, which are clinics at different pediatric hospitals, we collect biosamples, and through these efforts, more than 11,000 children and adolescents are enrolled in the CARRA registry. This involves more than 47,000 visits, and there are also follow-up visits after children graduate from pediatric care to adult care. Over 2,000 patients are participating in this. So this is a really robust network that didn't exist and couldn't exist without the Arthritis Foundation support. Next slide. So we're doing all sorts of research with this CARRA and Arthritis Foundation partnership. Foundational at the bottom of this diagram is the CARRA Patient Registry, which I described to you. And through this registry, we're learning more about different types of presentations and aspects of children with JA and other rheumatic diseases. We're comparing treatments to each other, assessing quality of treatments, looking at long-term safety, and storing tissue and genetics to help us understand the very basic causes of disease as well. We're trying to translate this research that we understand to the clinics and inform clinical trials to allow us to have new treatments to treat better and cure JA. Next story. So I'd like to give you an example of the type of research that we're doing right now. Particularly in the coming year, the Arthritis Foundation and CARRA are going to focus on something called the Consensus Treatment Program. Now, what a Consensus Treatment Program involves is looking through the literature and surveying doctors about the practices and approaches they'd use to treat a particular condition. So let's say, for example, a particular type of JIA like spondyloarthropathy in Antoinette's case, or perhaps a particular condition like the eye inflammation or uveitis that can complicate JIA. With all of the doctors and investigators partnered together to decide we're going to study these 3 or 4 different treatment approaches to this disease, they develop a standard approach to treatment. All the centers in the registry that I talked about agree to abide by these treatments. We collect data on patients like Antoinette who participate in the registry. And then using the data from these over 11,000 patients, we can then compare the benefits and side effects and learn which treatments are better and which side effects are happening in our patients. It is critical that patients participate in all steps of this research. So we need you. We need you to help us participate in this research. Next slide. So over the past year, CARRA has published several different research studies, and I would just like to highlight 3 of them to help you understand the kind of work we're doing together. So the first is the results of the STOP JIA trial. This is actually a study of the Consensus Treatment Program, or CTP, process I just described to evaluate 3 different treatment approaches for a particular type of JIA, polyarticular JIA. Results from this study, which involved over 400 children, show that all of these treatment arms worked well, which was really good news, and provided some hints to us that upfront, more intense therapy and treatment of arthritis may have some benefits over other treatments. Next slide. Another research study I'd like to highlight is one that focused on mental health and examined the impact of mental health, the high prevalence of depression and anxiety among children struggling with rheumatic diseases like JA, and also the barriers families face in getting the mental health treatment they need. And the results of this study will inform efforts to improve access to mental health treatments for children with JIA. Next slide. Finally, this is another study that came from the CARRA registry that I'd like to highlight. This looked at the condition juvenile spondyloarthritis, which is what Antoinette had in the story we shared earlier. And Antoinette actually contributed her information. So she was one of the participants in this research study, along with 900 other children, which is incredible. That number is just incredible. These are rare diseases, and to be able to study 900 children with this particular condition is just amazing. So one of the important findings from this study was that this condition was equally present in girls and boys. And this is absolutely contrary to prior research and prior understanding. For a long time, people have assumed that males get this condition more frequently than females, and thus when females present with this condition, there's often a delay in diagnosis. So these findings will help to illuminate our understanding that this disease affects girls and boys equally, and hopefully improve treatment for all with spondyloarthritis. Next slide. So I'd like to thank you for allowing me to talk to you about the power of research, patient engagement, and the Arthritis Foundation and CARRA Partnership. And I'd now like to hang things back over to Steve. Thank you.
Thank you so much, Dr. Ardoin. A very great presentation. So much happening in CARRA and Arthritis Foundation's partnership in research. We truly appreciate your leadership as well as the other leadership of the pediatric rheumatologists involved. I want to remind everyone how important your voice is. I mentioned earlier, as did Anne, regarding our work in advocacy to ensure that NIH continues to fund research in pediatric rheumatology in our advocacy department. And many of you who are involved in that are working hard to ensure that. And of course, our commitment, as I mentioned, to CARRA has been over $30 million to research funding in the past 6 years. And we continue to fund CARRA and their amazing work as we move forward. And I hope that you'll connect with local pediatric rheumatologists that are involved in the registry and see how your voice can help create new ideas and also what you can learn by taking part in the registry. On the final slide, I just want to remind everyone before we open it up for questions that you can find more information about research and all of the programs for the Arthritis Foundation by visiting the JA Conference app. And I encourage you to also look up the JA Insights Assessment Program that's found on your app for you and the kids that are involved to take that JA assessment so that we can learn more about how it is to live with JA, as well as various information about health history, which will help determine our future programming as well as our future research needs. And so it's so important that we have more and more assessments being taken. So I encourage you to take some time today or at a break to go and take the JA Insights Assessment. And then finally, by signing up for the Arthritis Foundation Live Yes Arthritis Network, you'll be able to find information about JA Connect groups, JA days, local community events such as our Jingle Bell runs that are coming up this fall that will be live events that we hope you'll be out supporting the runners and walkers or taking part yourself. As well as you'll find local research initiatives that are happening and how you can get involved in things that Dr. Ardoin spoke about. So I encourage you to go there at arthritis.org/liveyes and sign up so that you're on our email list and you find out about all the amazing programs that are happening locally. And I'd be remiss if you don't find things locally, please consider volunteering and stepping up. We can always use JA families for new JA Connect groups, JA Days chair people to bring together the JA families that live near you so you can support each other and that the kids can meet each other as well. So consider getting involved by signing up at that website. And now I know we have some time, so we want to be able to take questions, and we're going to bring back up Ann Palmer, CEO of the Arthritis Foundation, and Frank Longobardi, the board chair. And of course, Jen and Shane will be in the background to answer any questions regarding conference or being a parent or a child with JA as well. So we really want to open up to research questions or any questions you might have around JA, and you can put them in the chat. And we can take them from there. I think because I don't believe we can bring people live on this version of Zoom, but by all means, you can put in your questions in the chat room as well. So first, I'm going to throw it over to Ann, and Ann, just a few, I don't know if you have a few comments while we wait for some chats to come in. I know your commitment to JA research has been since you joined the Arthritis Foundation, how important it is to you as for our organization. Do you want to share just some closing thoughts on that while we wait for some questions?
Yeah, I mean, I think that, CARRA is an amazing organization, and they, took the initiative as leaders long ago to want to create a registry as a base of collecting data to deal with the many forms of pediatric rheumatic disease. And, we made the choice as an organization that we would invest in CARRA as our research commitment rather than starting a competitive program because we're a small community and we need to, work together as give the great examples around advocacy. And so, we're very committed to continuing the work with CARRA, and this year in particular, really seeing the benefit of some of the work we've done before with consensus treatment plans and moving those forward to really comparative effectiveness and understanding, what treatments are best for people, and helping parents make those tough decisions about when to start what kind of treatment, and knowing what, those hard decisions as a parent that we all have to make. So we're excited about that. And we're excited about, really looking at the opportunities we have now as research sort of grows up. And we're also, we're as an organization, and in our work with CARRA, now really knowing that we have to be more serious about disparities in healthcare, and making sure that we're doing the best we can do in those areas as well. So a great partnership. Sometimes we have challenging discussions, but we're all passionate, and CARRA's a passionate partner in with us in wanting to fight for the things that are important to families. And those things are, what treatment should my child be on? What are the side effects, and what's the next treatment when this one stops working? And ultimately, even when many of our children, when they're on a treatment, they're not 100%. And so we've always got to be looking for the new, the best, the most effective treatments possible.
Absolutely. And I saw a question come in. I'll throw it to Dr. Ardoin regarding what research has shown in mental health, or what things have been happening over the past year on mental health for children with JA. Oh, you're muted.
Thanks, Steve. It's a really important question. We actually have an entire work group within CARRA that focuses on this very issue, both for children with JA and other rheumatic diseases, and have done a lot of research looking at how mental health affects patients, their families, and even the providers who are taking care of these patients. And what we found, particularly in this study, was that patients reported symptoms of depression and anxiety very frequently, much more frequently than we thought. And this is across all rheumatic diseases, but including juvenile arthritis. The alarming thing that these families also reported to us was that access to mental health resources was far lower than it should be. So, for example, only 60% of patients and families reported knowing how to or being able to access mental health. So really highlighting the important work we have to do to better understand and treat these conditions, and make sure through advocacy that these patients and families have access to appropriate mental health therapies.
And I think that's a good reason too, to get involved with groups like our local Connect groups. It's a place where you can find help and support, and where we can bring in subject matter experts or connect you with mental health specialists if needed. So again, really want to just encourage people to stay engaged, and to know that it's not just at conference that we have the opportunity to provide resources and connections.
Absolutely. And I think there's another question regarding parent experiences and children. And again, getting involved locally through the JA Connect groups can help with that. Of course, this conference has amazing breakouts as well. And in a minute, I'll ask maybe Jen to share a little bit about some of the upcoming breakouts that people can go into for children, and for the parents to share their experiences amongst each other. But there is a question, I'll go back to Dr. Ardoin on, regarding what studies have been done regarding following children into adulthood to see the long-term effects of medications, et cetera. I don't know if you want to share a little bit about that.
Yeah, so that has been a real missed opportunity in the past, because we would have investigators really focusing just on children or just on adults. And one of the really powerful things that this CARRA registry is doing is following children through this registry until they graduate to adult care, but then also keeping connected with those patients and families through a phone call system to annually update how they're doing. And this will really provide the very first long-term assessment in a large number of patients on outcomes. So we know some things from very small studies, but this will be really groundbreaking when we have information on these 11,000 children who are in the registry.
And also, I'll just add to that. So not only are we working through CARRA through some research on that, we also at the Arthritis Foundation just awarded Children's Hospital of Philadelphia a fellowship regarding transitioning children to adulthood through a fellowship that will be an adult pediatric rheumatologist that will be working on some work in that area as well, which is, we know that transition is a challenge. We know it's a challenge for any child, but someone with a chronic disease such as JA, it's so important that that transition happens correctly, and the partnership between an adult and a pediatric rheumatologist happens. So watch for more information about that project that'll be starting later this fall on the Arthritis Foundation side, but the CARRA side as well, the research, we continue to look at those long-term longitudinal studies as well. Jen and Shane, I don't know if you want to quickly talk about some upcoming breakouts that are going to be happening regarding some parent experiences and children experiences and how they could take part this afternoon on sharing with each other.
So there's, in the conference, we really wanted to make sure that we had a lot of things available for all age groups. And later on today, there are a lot of things we have pre-recorded. So when you have a few minutes in between the general sessions, definitely hop on your app or your desktop version and check out one that I know was super helpful to me when I attended our very first conference, being brand new for any of our new families. Really check out the JIA 101 the first 2 years. It's where you can get information that'll kind of help ease some of those fears and maybe answer some questions that you have, and get some information to kind of help you as you're getting started in your JA journey. Because it can be very, very overwhelming when you are facing that first year or two. Even if you've been diagnosed within the past couple of years, it's very daunting at times to be facing all of that. So getting to some good background information, and don't hesitate to reach out to any veteran families that you've met through the networking sessions, because we are very eager and willing and happy to answer any questions that we can for you. And then also later today, it could be 12:10 Pacific time, 3:10 Eastern time. Our next general session will be going over some very timely and pertinent information regarding COVID. And I know as we're all getting back into, heading back into school, we have a lot of questions surrounding that. So just getting some background information on what the docs have and will be sharing with us surrounding that will be helpful for all age groups.
That's great. And I'm going to go back to Dr. Ardoin in a second. I just want to mention, because I have a question regarding how parents and children can get the most out of this conference to also bring back to their pediatric rheumatologist as well, and how they can become a good partner with what they learn. But first, I just want to mention our websites again, because I know that came up in the chat, which we did put the links in there, but it's arthritis.org/live-yes, or arthritis.org/insights. And of course, the links are also in your JA conference app as well. So you can find everything there. But if you want to just go to arthritis.org, type in live yes, type in insights in the search, you'll come to the same page as well. So great information on the arthritis.org website on juvenile arthritis. But Dr. Ardoin, do you want to talk a little bit about how you can be a great partner with your pediatric rheumatologist with what you've learned this weekend?
Absolutely. So there are so many ways that the patient partnership with the provider really can be so powerful to improve care. So one is to always be asking questions about the latest research. Your pediatric rheumatologist will know about this and be up to date, and they want to share it with you. Talk to them about opportunities to get engaged in research, whether it be through CARRA or through another opportunity. You are so powerful as a patient and family. Your participation in research is what's going to fuel better treatments and outcomes in the future. And then lastly, all of our pediatric rheumatologists are engaged in one way or another with their local Arthritis Foundation. So if you haven't already connected with the Arthritis Foundation close to home, talk to your pediatric rheumatologist, because they can let you know about some of the great opportunities that exist and opportunities to work together. And just, ask questions. That's my fundamental advice to you, is always ask questions. We are always want you to do that and happy to work with you.
That's great. Thank you so much. And by all means, the Arthritis Foundation is always available for questions, not only at the national level with all of our staff, but also locally with our amazing volunteers, our JA chairs, as well as our JA Connect group leaders. So by all means, always connect to get your answers that you need and the support you need from our great network. I want to, as we wrap up, I want to throw it back to Frank since he began the session. Just Frank, do you want to just share how important the juvenile arthritis commitment is from the Arthritis Foundation Board of Directors as well?
Yeah, thanks, Steve. For sure. Listen, as I mentioned before, we have rheumatologists and JA parents on our board, and it is really a critical part of what we do, our mission, how we go about it. And we have a deep commitment to juvenile arthritis and the importance of our relationship with CARRA as well. And so you could rest assured that we're doing everything we can to kind of help this process. And I encourage all of you to stay connected to us throughout the year. Don't make this, as Ann says, a one-time event. Stay connected. Get involved with Connect groups. There's a lot we can do. Help us with research. Help us with some of the things that we're doing. Fundraising obviously is important to our organization as we continue to try to increase our investment in research. So all those things are a big part. And again, I love the courage and the inspiration that you all show, regarding this terrible disease. So thank you very much.
Thank you very much, Frank. And with that, I'm going to turn it back to Jen and Shane to close out our session and send us off to the rest of the conference. Enjoy the conference. Thank you, Dr. Ardoin. Of course, thank you, Ann, for your commitment, and Frank as well. So Jen and Shane, back to you.
Wow, thank you so much, Steve and Dr. Ardoin, for that presentation. And thank you also to Ann Palmer and Frank Longobardi for demonstrating that the Arthritis Foundation is continuing the fight against juvenile arthritis. Before we end the session, we have a few reminders for you.
Be sure to check the conference app for any updates, session descriptions, and the participant links for joining sessions. You can access the links in JA Insights. Please take part in the research assessment today. We have several breakout session options to choose from today and tomorrow. Some are live and some are pre-recorded. Details for which sessions are live are included in the session descriptions in the conference app. Live sessions will be recorded and made available for a limited time after the conference.
The app has amazing pre-recorded content for kids and teens, so please check those out with your kids and teens whenever is convenient. They are listed with a start and end time in the schedule, but they can be watched at any time. I wanted to be sure to remind you for our keynote general session, COVID and JA vaccines and variants, this afternoon at 3:10 p.m. Eastern. So please stick around for that session. Check the conference out for the link to join that session. Please complete the evaluations for each session so that we can use the feedback to improve the conference program for next year. We factored in a quick break for you, so we will see you at breakout sessions shortly.